Greetings from Aster RV Hospital. I'm Dr. Shivani Chandan, consultant obstetrician gynaecologist and laparoscopic surgeon working at Aster RV Hospital, Bangalore. In this video, I'm going to talk about one of the most common gynecological conditions, that is fibroid uterus. A fibroid, which is also known as leiomyoma, is nothing but a benign, non-cancerous growth from the muscle tissue of the uterus. Now, these fibroids are the most common non-cancerous tumors arising in the pelvis of the woman. These can vary in size from few millimeters to extremely large sizes of 15 to 20 centimeters. These fibroids vary based on the location they arise from. They can arise inside the cavity, in the muscle layer, or outside, and can be connected to the uterus with a stalk. Now, what are the different types of fibroids? The fibroids, like I earlier mentioned, can be small. They can be in the cavity, which when we call it submucous, in the muscle layer, or outside. So what causes this fibroid uterus? The exact particular cause of fibroids is not known, but we have seen that it can run in the families. A mother who has a fibroid, then we've seen it in the same family in the daughter. So one thing that we do know about the fibroids is that they are hormone dependent. The hormones that are produced in our body, that is estrogen and progesterone. So these hormones enlarge the fibroid. We have seen this because following menopause, the fibroids tend to shrink. So it is very common during the reproductive age group as well. We have seen it most commonly from the 30s onwards, 30 years, in the 40s. They're very, very common in that age. Now, what are the symptoms that these fibroids can cause? Firstly, most fibroids, when they are small in size, do not cause any symptoms at all. Sometimes people have large fibroids and only discover it on a routine examination. It can be either a pelvic examination or during a routine health checkup. The most common symptoms that fibroid cause are heavy menstrual bleeding, where the bleeding is prolonged for more than a week, or where there's a lot of passage of clots, or the patient needs to change pads very frequently. So it causes menstrual disorders. Sometimes it can cause intermenstrual bleeding, severe pain during periods. It can cause pressure symptoms when it enlarges because it causes pressure on the surrounding structures like the bladder and the bowel. Finally, it can also cause issues related to fertility. It may not allow patients to conceive, especially if it is obstructing the cavity or invading into the cavity. How do we diagnose a fibroid? First, on routine examination, if the fibroid is large, it can be made by just touching your abdomen. We can feel a mass arising from the pelvis, and it can be felt on clinical examination. Then, in order to confirm the diagnosis, we do an ultrasound. Ultrasound is mainly done to map the fibroids. Where is it located? What is the size? Because the treatment depends upon the symptoms and the location and size of the fibroid. So a simple ultrasound, which is done on OPD basis, helps us to diagnose and confirm the fibroids. In rare cases where the fibroids are growing at a rapid rate or are very large, especially in the postmenopausal women, we recommend an MRI because there's a rare possibility that these fibroids can turn into cancer. We have seen it in 1 in 8,000 women, but even then, if the fibroid is large or you're postmenopausal or the fibroid has been growing at a rapid rate, then we recommend getting an MRI done. Now, coming to once a diagnosis is made, how do we treat a fibroid uterus? If you're asymptomatic and we've done a scan and we found that you have small fibroids, you finished your family and it's not affecting your fertility, then the ideal thing would be to monitor the fibroids on a yearly basis and just keep a check on how fast it is growing, or is it okay to wait. Most often we do not intervene in asymptomatic small fibroids. Next, if the fibroid is causing you menstrual symptoms such as heavy bleeding and pain, we can first line try with medications. So the first line of treatment for fibroids is medications. Simple medications for reducing the bleeding during periods and pain. The second would be hormonal pills and injections that suppress the hormones, but this cannot be used on a long-term basis. This can be used only on a short-term basis because the pills cannot have side effects if given for a prolonged time. And once the injections are stopped, the fibroids are known to regrow. So medications is the first option if you have a small fibroid and it's not causing major issues to fertility. Coming to the next option, that is the surgical option. If fertility is an issue and the fibroid is invading into the cavity or abutting the cavity, then we look at myomectomy as a line of management. in myomectomy, if it's completely inside the cavity, we do something called a hysteroscopic myomectomy, wherein we introduce a scope into the uterus, look at the fibroid, use a resectoscope and remove the fibroid. If the fibroid is present in the muscle layer and pushing the endometrium, or if it's outside the uterus, then we have to do a laparoscopic myomectomy. Remember that we do it only laparoscopically. The fibroid can be bought out of the abdomen by using a small device which grinds it, minces the tissue and brings it out, a morcellator. So laparoscopic myomectomy is another line of management if the fibroid is situated in the muscle or outside the uterus. Finally, if fertility is not an issue and if a person has completed the family and over and above around 45, 50 years and it's causing a lot of pressure symptoms, or if it's large, sometimes we can even feel that the uterus is enlarged up to 6 months pregnant size. In that case, the option would be to go for a hysterectomy. The hysterectomy is nothing but a surgical procedure to remove the uterus. We do it laparoscopically. You may wonder how such a large fibroid is delivered out, but after doing the hysterectomy, it can be done vaginally. We remove the fibroid, we cut it into pieces and remove it, or again, a morcellator is used in case of extremely large fibroids. Another last treatment option that I would like to talk about is uterine artery embolization. This is a procedure wherein an interventional radiologist pushes tiny particles into the uterine artery so that it occludes the blood flow to the fibroid. So the fibroid does shrink in size. This is an option for someone who is not looking at fertility. Although I would say that most patients who undergo uterine artery embolization require surgery at a later date, or they need follow-up wherein we've seen that the sizes tend to enlarge after a couple of years. So this is an option for someone who has small fibroids, who's symptomatic and not looking at fertility as an issue. To summarize, a fibroid uterus can be undiagnosed, so you should visit us on a regular basis so that it can be picked up early and followed up. Because if it is left untreated, if a patient has heavy bleeding, you can end up with issues with anemia because there's excessive blood bleeding and you tend to feel fatigued and weak and you don't know the cause for it. The second being that sometimes when it enlarges, it causes pressure symptoms on the surrounding structures like the ureter, the kidney, and it affects you in the long term. Very, very rare possibility of cancer also exists. Hence, when you have a fibroid, you should come for a regular checkup. And even in general, if you're asymptomatic but feel a mass per abdomen, you need to come regularly to the gynecologist, at least for an annual health checkup, so that this condition is picked up and treated early.